My name is Haripriya Maddur. I'm a transplant hepatologist at the University of Arizona in Tucson. It's really important to understand the cutoffs for ALT and not look at the population-based ranges. And then when you do have a patient who has MASLD, really important to then obtain the FIB-4 score. So if a patient has a FIB-4 score of less than 1.3, these are patients that you can simply counsel them on the presence of diet and exercise and then recalculate their scores every 2 to 3 years. If they have a score that's greater than 1.3, then these are patients that you really want to consider doing non-invasive testing such as your FibroScan, as well as your MRE elastography or ELF score. And if they have advanced fibrosis, definitely refer to hepatology. And especially anybody who has a score over 2.67, please refer those patients to us so that we can start treatment. But in answer to the question, really obtaining a FIB-4 score is probably the first thing I would do. I think it's, again, very important to explain to patients the importance of dietary modification and really staying away from ultra-processed foods, sugary foods, those red meat, as well as those high in saturated fat. I think that that is the most important thing. And when I'm managing my patients, I think that I also try to be very understanding. I try to explain to them the importance of weight loss and dietary modification, but I also understand that it is easier said than done, and I try to use compassion when explaining to them the need for changes in their lifestyle. So in patients who have fatty liver disease, it's really important to make sure that there is a dietitian or a nutritionist involved, because patients still have a very hard time with knowing what is high protein if they have cirrhosis, what are ultra-processed foods, what sugary foods should I stay away from. So I think that one of the most important things is having a nutritionist or a dietitian involved that can help guide these patients and help create meal plans. Another thing that's really helpful, especially in your diabetic patients, is having an endocrinologist involved, because GLP-1 inhibitors are a fantastic choice for patients who have diabetes. So it's really important that an endocrinologist also be involved in their care. I really do think that the diet and exercise can also, well, specifically the diet can change a little bit of the gut microbiome and therefore decrease the amount of fat deposition within the liver. So I think it's kind of been answered a little bit, but I really do think that it's one of the major treatments for this disease.